Hi guys, the Tory excuse for the increase in the NHS waiting list over the last number of years has been that there was a pandemic, which meant that many operations and treatments were either cancelled or postponed. What they like to ignore is the fact that the waiting list was at a record level before COVID. So when Health Minister Marie Caulfield was asked about this, what do you think her response was? Well, that the numbers are not important. Why? Well, because technology. Have a listen to this.
Since 2010, we've seen, even before the pandemic, waiting lists for hospital treatment nearly doubled, and that was from 2010 to before the pandemic. So I think it's hard to say that the Conservative record's good.
Well, it's not how many people are on the waiting list that is the important factor, because as we develop new treatments, as we open up new services, as people get conditions that can be treated, waiting lists, of course, will grow. More people will be waiting for treatment, but it's how long they wait. This time last year, people were waiting over 2 years because of the COVID backlogs. It's now on average 16 to 18 weeks. So that's a significant reduction. The same cannot be said in Labour-run Wales, where the waiting lists and the waiting times are increasing. And so, Labour say they have a plan for the NHS, but where they are responsible for it, actually they're seeing a far worse performance in their health services.
Oh my goodness. Okay, you can't compare NHS England and NHS Wales because, as we know, the Welsh administration is devolved. So it means that if they want to bring in extra doctors and nurses from abroad, post-Brexit, it's more difficult because, well, who controls immigration? Westminster controls immigration. The Home Office is responsible for issuing more visas. So when it comes to the Welsh administration, they can't bring in extra workers like they could in England, because who's in control of England? Well, the Conservative government. And then, of course, Wales has a devolved administration when it comes to the budget. So if they would like to spend more money on the NHS, they're limited in what they can do. Westminster instead can throw more money at the problem, although they're not deciding to do that. And of course, when it comes to the figures themselves, well, the Conservatives are cooking the books, bringing down waiting lists, bringing down the time people are waiting. More and more people are giving up and they're going privately. Maybe that's by design. The Conservatives have decided, let's run the NHS into the ground. Let's underfund it. Funding has increased, but where is that money going? It's going into the private sector. And people who are on the waiting list, many of them who have the money have just given up and gone privately. As I said, this is probably by design. Ideologically, the Conservatives don't support the NHS. They would like to see it all sold off and more people rely on the private sector. And economically, they have not provided it with sufficient funding. Whatever increase in funding there is, a lot of that goes to the private sector, for example, to agency staff when it comes to NHS nurses, to outsourced services, which the NHS should have in-house, but they can't because they can't get the staff. So it's a case of, let's run this service into the ground. Let's force more and more people to rely on the private sector. And then we'll claim that, well, we're succeeding while Labour aren't, and we'll point the finger at Wales, which of course is a different situation completely. Let me know in the comment section, guys, what you think. As always, your comments are greatly appreciated. Thanks a lot.